Hello, I'm Bahram Jam, a physiotherapist in Toronto, Canada, and I'd like to share with you this presentation titled Music-Induced Analgesia, or MIA. First, let me begin with a quote by Bob Marley. One good thing about music, when it hits you, you feel no pain. My journey started a few years ago when I was so passionately involved with the opioid crisis, meaning I researched everything I could, I had patience with opioid addiction, and I decided to combine my passion for talking about the opioid crisis in a music video. So a few years ago, I made this video titled Opioid Crisis. It's available on YouTube. You just have to search Bahram Jam and Opioid Crisis and you'll see it. And I hope its message gets across to as many people as possible. Thank you for taking the time to watch this, and then we'll get back to my presentation after the video.
How much painkillers are you currently taking? A fairly common question asked. If less, proudly answered. If more, embarrassed, a sense of disgrace unmasked. Opioids, pain medications, a necessity at times based on unique pasts. At times essential, making life worth living, irrefutable quality of life contrast. No need for shame, no need for guilt, a desperate natural craving for relief, no need to deny, a temporary escape, a momentary aid, an end to suffering, a much needed high. Strong morphine, a compassionate way in palliative care before one dies. Its original intention, reduce suffering for those passing, respectful, humane, civilized. But as medical business models soon realize, no long-term profitability though. And those who soon shall pass, a better business model focusing on dependency cash flow. Too few people suffering on deathbeds, sorrowfully not long they remain. Incentivized targeting the millions living in desperation with chronic pain. When medicine is business, the assumption is always more and stronger is better. No long-term revenue in healthy patients, or those who recover, or those who sadly expire. Thriving financially for years and years on the backs of those in a state of ongoing chronic disease. A facade disguised as noble intentions. Censorship for anyone who disagrees. Oxycodone, hydrocodone, a remarkable addition to modern medicine without a single doubt. Intended for short-term use, post-surgery, pain from cancer, a predetermined finite amount. Yet those rendering them either in medical offices or on the streets, rarely discussing strategies. No plans to ever taper off them, no plans to be without them. The treatment now worse than the original disease. Analogous to a plane taken off, the pilot never trained in a safe and smooth landing. Impossible to permanently remain high in the sky, an inevitable disaster pending. A highly addictive drug without proper instructions, reviews of its side effects and calculated risks. In the hands of a person who feels alone, a life lacking meaning, a predestined crash landing. Opioids inducing pleasure, reducing pain, what could be so dire about that? Synthetic or natural, legal or off the streets, very effective painkillers, and that's a fact. For decades, their manufacturers denied and underplayed highly addictive nature of it all. The opioid crisis is of no accident, pre-planned, a perfectly executed protocol. Three out of 4 heroin users originally began with opioid pills, either prescribed or illegal. As pills become harder to come by, desperately turning towards heroin or deadly fentanyl. Perhaps cheaper, more potent, accessible with greater ease in a frantic circumstance. Physical dependence, addiction, more and more opioids needed, compensating for a built-up tolerance. For decades, their manufacturers denied and underplayed the highly addictive nature of it all. The opioid crisis is of no accident. Pre-planned, a perfectly executed protocol.
Welcome back. Is there evidence to support pain neuroscience education, which we're going to call PNE? PNE is effective in improving pain, disability, and psychosocial factors in patients with fibromyalgia, chronic low back pain, chronic fatigue syndrome, and chronic spinal pain. So this is from a 2023 systematic review offering some evidence for its efficacy. Is there evidence to support PNE just on its own? The effectiveness of PNE in isolation did not show statistically significant improvements overall in terms of pain intensity, disability levels, or psychosocial variables. What this means is if we just offer people education and do nothing else, meaning no other prescription of exercise, activity, fear reduction, on its own, it doesn't do much. Is there evidence to support PNE plus physical exercise? PNE plus exercise has been found to be an effective intervention for reducing perceived pain experience, pain interference, and other psychosocial variables in the management of chronic pain. So that's the 2025 systematic review. PNE is typically offered through a single session, several weekly sessions. It can be anything from actually 1 to 12 weeks, one-to-one oral sessions, group education classes, educational videos, educational pamphlets, and educational books. The original book being Explain Pain by David Butler and Lorimer Mosley. And then there is Why Do I Hurt by Adrienne Lowe, an excellent book, physiotherapist in the US. Then there's Greg Lehman, Recovery Strategies, an excellent book. And there's, of course, The Pain Truth, which is my workbook, which I'm partially biased towards, I admit. Change the way you look at things, and the things you look at change. Basically, that's the entire purpose of pain science education, to give people a new way of looking at pain. However, to date, no one has studied the efficacy of offering PNE through theater and music. And that's why I started this project sometime during COVID, where I decided, you know what, my dream was always to write a musical, because I'm a musical junkie. And the topic that I'm most passionate about and have studied the most is pain. And therefore I said, why not combine the two, musical theater and pain, to offer pain education. Pain the Musical offers an opportunity for people to experience MIA and learn about pain in a novel way. Please take the time to view this trailer on the musical. Thanks.
Last night I cried, I thought I died, I was in pain, I couldn't breathe. Woke up this morning, realized...
I've been a physiotherapist for 32 years, and my main area of focus has been on chronic pain. And chronic pain is one of those conditions that medical professionals don't like treating because it's frustrating. They don't respond to treatment, hence the diagnosis of chronic pain. Research study shows the greatest thing we can do for people with chronic pain is to actually address the emotional aspects of chronic pain. And so I believe that somehow through music and theater is another way of touching people's lives.
Any and all musicals that are successful have some element of comedy or lightness. The more that the audience laughs with you earlier in the show, the more willing they will be to cry with you later in the show, because the two things connect.
To move forward and to heal ourselves, we can't play victims in our own life, and that's said in the play.
To my knowledge, no one had ever attempted to personify pain and make it like a real character that is perceived as being a villain and an evil thing, yet deep down pain is good. Pain is essential for us. Escaping pain does not work. Ignoring pain does not work. Accepting, embracing it, and listening to it is our only way forward.
And the characters really started to become representative of quite naturally through the process of writing 4 states of being that are very fundamentally identified with the idea of chronic pain: fear, stress, grief, anger, and anger. And so 4 of the characters quite clearly are expressive and evocative, right, of these identifying states of being.
To make it a lighthearted and in fact a joyous show, yet not diminishing the seriousness of chronic pain in any way. Because we know from the audience reviews we had from the first workshop reading was incredible. They also how touched and moved they were, and how they extremely enjoyed the show on pain,
and yet they came out feeling a sense of being heard, which is what was the ultimate goal of this show. People with pain to be given a voice.
Yes, there's a fire inside me. It doesn't hurt. It burns. It burns.
So, as a recovering opioid addict, obviously this topic is very personal to me. Every story, every character from play really, really speaks to me. Every layer of pain and how, you can't escape, you can't blame other people for it. You have to, take responsibility for what you're feeling inside. That was so beautiful because you can't run from pain, It's what you're feeling on the inside. So thank you for making this. Thank you for inviting me. Thank you.
Let's talk about music-induced analgesia. So what is MIA? MIA is a phenomenon that describes a situation in which a reduction in pain perception occurs after experiencing music. Music has been shown to not only be effective at reducing pain, but also efficacious at reducing anxiety and depression. There are actually a number of studies supporting the benefits of joining a choir, for example. Is there evidence to support music-induced analgesia? Music may be beneficial as an adjuvant for chronic pain patients as it reduces self-reported pain. This is based on a 2017 systematic review. Is MIA possible for those post-op? Here's a summary from a meta-analysis titled The Effect of Perioperative Music on Medication Requirements and Hospital Length of Stay, meta-analysis. Perioperative music can reduce opioid and sedative medication requirement, potentially improving patient outcome and reducing medical costs. Which seems incredible that we have a meta-analysis on this, yet I can't recall the last time at a hospital before surgery anyone was offered 20 minutes of mindful listening to music. It is easy to imagine that a drug with similar efficacy and safety would be widely used in treating patients with chronic pain. Is there research on the neurophysiology behind MIA? There are currently numerous studies offering detailed neurophysiological explanations for the potential physical and mental health benefits of various forms of music interventions. These results indicate that intense pleasure in response to music can lead to dopamine release. For example, this is a study published in Nature Neuroscience, and this is a review paper published in the Journal of Pain, and in summary it says, neuroimaging studies have shown that pleasurable music strongly activates the brain reward system by stimulating the mesolimbic dopaminergic circuitry and release of dopamine. So, and this study was published, Isn't There Room for Music in Chronic Pain Management? Pleasurable music has been shown to trigger the release of dopamine, endorphins, oxytocin, which have pain-relieving effects. And this is published in a journal that's titled, Dopamine Modulates the Reward Experiences Elicited by Music. What about patient satisfaction? Perhaps the most important benefit of music as an adjunct intervention is that it can increase patient satisfaction in a variety of medical conditions, from chronic pain to cancer to post-stroke. And there are plenty of evidence for several medical conditions which it has been shown to be effective in. Based on the current evidence, one could assume that healthcare providers at pain clinics would be at the forefront of prescribing music as a potentially safe and cost-effective intervention. But that doesn't happen. Note, these are AI-generated images and not from a real clinic. I don't think you're going to find a doctor or a therapist playing their guitar or a piano anytime soon to help a patient. But I'm going to offer you, before this presentation is over, how in a clinical setting we can help people without taking out our guitar or piano or harp or violin. However, despite decades of research on the potential benefits of various music interventions, there continues to be a lack of translation barrier into clinical practice. No matter how many studies are published, how many meta-analysis, systematic reviews, you will still find it rare for a doctor to ever prescribe someone to try the course of music therapy. In fact, music therapists are quite rare, and they're not funded in hospital and pain care settings, when they in fact should be. Regrettably, due to a lack of awareness of the scientific evidence supporting MIA, patients and many healthcare providers consider the use of music as an intervention for pain to simply be absurd. Are you crazy? You want me to listen to music? A waste of time. I'm not wasting my time listening to music. And even childish. What am I, a child? You want me to listen to music? I have real pain here, and you want me to listen to music? Seriously? Are you pulling my leg? I need and want real treatments for my pain. And by real treatments, they mean medications, injections, various manual therapies, acupuncture, something that is visible to them to fix them. So a common limitation to applying music-induced analgesia into clinical practice is the patient's lack of consent and even desire to participate in any form of music interventions. So on one hand, we have the physicians and healthcare providers, including therapists, lack of awareness of the potential value of music for chronic pain. And on the other hand, we got the patients themselves and individuals who simply cannot believe that music in any way could possibly help their pain. As popular as pain clinics are, the latest 2025 clinical practice guideline published in the British Medical Journal now issues strong recommendations against the following treatments for chronic pain. They go against joint radiofrequency ablation. They go against targeted anesthetic and steroid injections. They go against epidural injection of local anesthetic. They go against intramuscular injection of local anesthetic. And they go against dorsal root ganglion and radiofrequency. Again, this is a clinical practice guideline published by the best doctors and PhD people in the world, published in the British Medical Journal, that go against routine things that are done at pain clinics across Canada, USA, and in the Western world. Now, if systematic reviews are not listened to by healthcare professionals, I don't know what else there is to do. In an ideal world, MIA interventions would be given as an option and be carried out by certified music therapists at all pain clinics and hospitals. But the reality is that music therapists are not routinely available in most healthcare settings. If I had a say in the healthcare system, what to fund, I would certainly fund music therapy because that is my bias. And I'm an evidence-based person. And I would say, based on the evidence and the low cost and the zero side effects associated with it, why not offer this as a treatment? A music therapist could individualize treatments or even help deliver music-based interventions in a group setting whenever it's appropriate. If healthcare providers and patients don't have direct access to a music therapist, which majority don't, the next best option is to simply share with them that listening to enjoyable music as another viable option for pain management and for emotional well-being. So what type of music is most effective? Most people say classical music or Beethoven or Tchaikovsky, something like that. But the truth is, the simple answer is whatever style or genre of music that is preferred and enjoyable by the individual. Ideally, it should be a piece of music that they find moving or a series of songs that they can relate to that takes them through an emotional journey. So if a patient likes opera, they should listen to the opera. If they like country music, then they should listen to country music. If they like musicals like I do, listen to musicals. If they like heavy metal, absolutely, listen to heavy metal music. Think of it. Some people going through a heartbreak find comfort in listening to Adele. Adele writes heartbreak songs, and of course, they're popular. Good, any song that has this is James Blunt, Goodbye My Lover. And of course, Taylor Swift has no shortage of songs about heartbreak and breaking up with boyfriends, where they may sense consoled in having their heartbreak and emotional pains validated. The most important thing people want when they're experiencing pain or any kind of physical or emotional pain is to be validated. And music is one form of doing that. There's no shortage of heartache songs out there, but not many on physical pain. Here's a 1-minute sample from Pain the Musical that I'd like to share with you.
One fateful day, my whole life was suspended while driving home from work. My car was rear-ended. Naively, I made the assumption I'll get better in a flash. Nothing was ruptured, nothing was broken. It's only whiplash. But now neck pain, vertigo, insomnia, in an endless succession. I'm slowly breaking down, taking pills for depression. My crippling distress and anxiety drives me to search for a cure. Physio, chiro, osteopaths, as much as I can possibly endure. I only eat organics, count my carbs, and try to live a life at peace. I meditate each morning to encourage my endorphins to release. Pilates at minimum 2 times a week. Yoga classes downtown, yet I'm consumed with nervous tension. And my life's turned upside down.
Welcome back. The aim of that short music sample was to validate those living with chronic pain by having them feel heard and represented. The undeniable fact is that the patient's emotional connection to the music is more crucial for experiencing music-induced analgesia than the actual music itself. Again, what type of music is best for producing music-induced analgesia? Individual preferences for music attributes play a significant role in MIA, and that, in clinical context, music should not be chosen arbitrarily, but according to individual preferences. So, what is the dosage that is recommended? It's great to listen to music while driving, cooking, or exercising, but the primary benefits seem to be achieved when music is listened to mindfully. By mindfully, it's meant that it's done with headphones, perhaps, eyes closed, without distractions, and with pure focus on the music. Ideally, for a minimum of 20 minutes, perhaps twice a day, for 3 weeks before results are experienced. I'd like to share with you one more music from Pain the Musical, and this one's titled Pain Speaks. So if pain could speak, what would it say?
They're not in me, Dr. J. I'm not a cave that they have to escape or a punishment for when they misbehave. You want to know why I'm here? Great. I'll turn off the jokes and give it to you straight. I received this body, this flesh, this voice. Yes, I materialized. I had no choice. I had to stand, had to walk, had to talk and be heard. I needed you to see me and hear my every word. Now, from my unique point of view, I can share my side of the story with you. I long to be accepted, not rejected, but respected. But most of all, to be listened to. As your pain, can you answer for me one simple question? When you think about me, what's your perception? Am I the hero, the real McCoy, or just a villain that you hope to destroy?
I don't wanna hear you, be near you, or fear you in any way. Why must you possess me, distress me, depress me each and every day?
I know sometimes I linger longer than you like, but when you refuse to listen to me, that's when my levels spike. So why do you disdain me? I just don't get it. I help you to survive, and yet I never seem to get the credit.
Tricked, bullied, loathed, betrayed, angry, hostile, bitter, afraid, desperate, detested, deceived, deplored, on edge, frantic, anxious, ignored.
It sounds absurd, but I yearn to be heard.
All right, you received this body, this flesh, this voice, and yes, you materialized. I guess you had no choice. You had to stand, had to walk, had to talk and be heard. So what you gotta say, Mr. Theater of the Absurd?
Okay, why the heck do I always seem to get the blame time after time? Pain gets a bad name. Accusations based on a false smear campaign. Hounded, surrounded, confounded, forever framed. Sure, I might appear after an injury, but how's that my fault? It's just what came to be. I don't deserve all this rancor and hostility, so stop the accusations. I'm not your enemy.
You are not my friend, pain. Comprehend pain. Do not pretend pain and do not reappear. Despite what you proclaim, you do deserve the blame. I wish you never came. Stop returning and returning and returning here.
Chronic pain, people, is a worldwide epidemic. But the problem isn't physical, it's systemic. Persecution, abandonment, and isolation? Do you really think that you can solve this with a medication?
Bullied,
Kill me with a
betrayed,
pill?
angry, hostile.
You're defeated
bitter,
before you
afraid,
begin.
Desperate, detested.
Wage a
deceived,
war against
deplored,
me?
On edge.
The
frantic,
truth is, you'll
anxious,
never ever
ignored.
win. Yes, people want their pain to go away or decrease, but to truly ease their suffering, they have to make their peace with me. The constant struggle to escape's a tiring act. The harder it's attempted, the more severe the impact on the spirit. It's fine to blame the reason for your pain, but to blame pain itself? Honestly, I'm not a ball and chain. If I could help you grasp one thing, I would!
All right! What's the one thing you would tell us if you could?
Pain is good.
As we reach the end of this presentation, I'd like to share with you a few audience reviews from Pain the Musical. As someone who has been in rehab for opioid addiction, I wish I had known the information offered in this ingenious musical years ago. The message in this show needs to be heard by anyone who is now living with physical and emotional pain. This show is pure genius. Each word is carefully chosen, each note perfectly placed to disrupt the stigma that is chronic pain. A perfect blend of depth, humor, and an amazing storyline. A must-see for all MDs and those living with pain. One good thing about music, when it hits you, you feel no pain. Bob Marley. Change the way you look at things, and the things you look at change, which is the essence of Pain the Musical. And on a final note, I dream of a day when everyone, including healthcare providers, will have the opportunity to attend and experience the inspirational theatrical production. Thank you.